A new beauty trend is going more than skin deep. It connects to your brain. Dr. Shafu is here to share how neurocosmetics work. First of all, good morning and thank you for being here.
Good to be here.
Okay, neurocosmetics, what is this?
Right, it's a new term, and what's really interesting is that, as we've talked about on the show so often before, you know, the skin is the largest organ in the body. It's sort of the way that we interact with the world, but there's a lot of stress that occurs to the skin from damage from all kinds of chemicals, ultraviolet, etc. And the skin responds to this stress by causing premature aging and loss of collagen, etc. And what we found, Christina, is this new group of cosmeceuticals called neurocosmeceuticals that are more targeting that relationship between the skin and our nervous system, because we do know that with stress there can be increased neurotransmitters that will release what we call cytokines, and cytokines are those chemicals that can damage our skin and can cause premature aging, sunspots, etc.
Okay.
So these neuroceuticals are thought to work on these neuroreceptors and neurotransmitters in the skin to help reduce or prevent some of this from occurring.
So how does it work?
So there's still science to be done.
Okay.
So we don't know everything, certainly, but we do know that the way that these neurocosmeceuticals work, one system is that they actually work on these neurotransmitters and neuroreceptors to increase blood flow to the skin. So essentially, if there's increased blood flow to the skin, we're seeing more hydration, we're seeing more products that are coming to our skin that will repair damage to the skin. There are other neurocosmeceuticals that actually will target the release of certain endorphins in our bodies, like serotonin.
Okay.
And this is thought to help with our mood. Other neurotransmitters have been developed that can help reduce the inflammation that occurs in our skin from just simple stress. So it's thought to be almost stress relievers, if you will.
So are these topicals? Are these, like, well, how does
So these are actually topicals that are applied to the skin, and the concept is that they're absorbed through our pores in the skin, and they get further in the skin. And some of these are actually naturally occurring peptides in the skin, some of which can not only are thought to increase blood flow to the skin, but allow for the skin to repair and heal itself.
Okay, and so is that a neuropeptide? Is that?
So it's a neuropeptide.
Okay.
There are some of these that are actually thought to, hexapeptide 8 is one, that's thought to actually work on some of the muscles around the eyes to diminish the contractions. So the concept of, you know, Botox in a bottle, that probably is a little bit of an over-exaggeration. But we do know that the connection between the skin and the nervous system is real. For some of these actually will stimulate the olfactory nerve, and which is a central nervous system. The oldest nerve in mammals is a sense of smell.
Right.
And some of these products have a scent to smell like a hug or relaxation, with the concept of providing some level of calm and relaxation to the skin.
Okay, so this is really interesting. So I guess, there still needs to be, I guess, more studies, right?
Yes,
that needs to be done. But the idea is that you get these topicals that feed these you said neurotransmitters?
Neurotransmitters and neuroreceptors that are already there in our skin, that are functioning anyway, to stimulate those to have a positive response.
Interesting.
And so we're seeing more of these being developed. There are some natural products, there are some natural plants that actually have some of these peptides associated with them. So some of them affect temperature. Cooler temperature is thought to be more calming or relaxing. So there's still much that's really not well understood or not well known about the role of these neurocosmeceuticals. The thing, Christina, is that drugs are regulated by the FDA, as we've said so often before, and the FDA has pretty stringent requirements before a drug is released. It has to be both safe and effective. Unfortunately, the cosmeceutical industry, the beauty industry, if you will, is not under those same regulations. So there can be many claims made that may not necessarily be science-based. So the public has to be somewhat jaded about what is marketed to them as a product and what real effect it's going to have. We need the studies to understand this more. We know there is this, if you will, mind-body connection, but we're not really sure how much it is.
All right, Dr. Shafu, to be continued.